Could you just tell us what is hormone replacement therapy and who is it for?
Well, hormone replacement therapy is basically replacing a woman's hormone as they drop through menopause or even perimenopause, a time before menopause. And where the big controversy comes is especially bioidentical hormones versus the synthetic versions that are commonly used.
What are bioidentical
So
hormones?
bioidentical hormones are hormones that are exact copies of what a woman would normally produce, including estradiol, estriol, progesterone, testosterone. So exact copies, not synthetic versions. And with all this controversy, so I looked and reviewed all the literature on bioidentical hormones, because you'll find, again, some people like Suzanne Summers and Oprah saying, oh, women feel better. Then you have experts saying there's no studies. So looked and see if there were studies. There are hundreds of studies, and my findings were just published in a major medical journal, Postgraduate Medicine. And what was found is that bioidentical hormones are substantially different. They have different physiologic effects. They reduce the risk of breast cancer, while synthetic hormones increase the risk of breast cancer.
That's the key.
And they significantly protect against heart disease much better than synthetic hormones. And women do feel better on them. But really, I think the most important thing is the breast cancer risk, and they're much safer.
So stay away from the synthetic.
You don't want to do synthetic. And study after study after study shows that bioidentical hormones are safe and safer than synthetics.
Can you break down why people feel so bad after menopause?
Well, with menopause, all the hormones drop. You have low estrogen, low progesterone, low testosterone. And so when
this literally replaces those hormones.
Exactly. Now, they want to find a doctor who can customize those formulations, because every woman's different and can customize it for the different symptoms. Let's say a woman has a lot of anxiety associated with menopause. Then you want to do more of a progesterone replacement, and also decrease risk for breast cancer the more progesterone you give. Progestin, synthetic, would increase the risk. Or if they have more hot flashes, more depression, you want to do more of an estrogen. If they have low libido, more testosterone. So you need to find a doctor that can customize those preparations. The one-size-fits-all is no longer a good option.
Sure. And do you just interview them? Do you take blood samples? How do you find out what they need?
Well, really, a knowledgeable doctor can know by the symptoms, and that is the basis. Blood tests can also be helpful, but most of the time you don't even need those. Really, you look at the symptoms, and then once you replace it, you can check the levels and make sure they're optimal.
Okay. Now, I know that sometimes, are there any other risks for taking these types of drugs?
Well, that's when you look at a woman and say, okay, why would you want to take hormone replacement? Most of the time it's for the symptomatic relief. Other women, hey, I want to look younger, which is okay, and then that way you can put actually estrogen right on your face, and you actually reduce the risk of wrinkles. So again,
right on your face?
Right on your face. And
it comes in
cream. It comes in creams, yes. You don't want to take oral estrogen, because you take oral estrogen of any sort, goes to the liver, increases clotting factor, so increase the risk of stroke and heart attack, and increases binding protein, so all your thyroid drops, your growth hormone level drops, so you don't want to do that. So if a woman is at risk, especially let's say for heart disease, then, which most people are, that's what's going to get most of us, is you don't want to take oral estrogen. It's even bioidentical. You don't want to do it. You want to take a transdermal cream that doesn't go through the liver. It doesn't increase inflammation, doesn't increase clotting factors.
Very interesting.
Yeah, and then if a woman, I'll say, has a large risk for breast cancer, wants to do a predominantly progesterone preparation.
And can they go to you as well as other doctors, or are you the only one that
No,
supplies
there are many doctors doing this, so they just have to find that doctor. And if they talk to their OB or their family practitioner and say, do you do bioidentical hormones, you'll get an instant response. If there's no studies on that, which is wrong, or you'll have to look elsewhere. When you look at the immune system, there's basically two sides of the immune system, a cellular and a hormonal. They're usually in balance. Now what happens is with multiple immunizations, multiple vaccinations, without thimerosal, it drives it in that hormonal way, and it basically becomes imbalanced. So what you get, you're more prone to these conditions that have that imbalance. What does that include? Autism, ADHD, asthma, chronic fatigue syndrome, fibromyalgia. Those are exploding in the environment. So what's going on?
Women who take bioidentical hormones have said they never felt better. Bioidenticals are not FDA approved, and many doctors say the so-called natural hormone therapy can be harmful to women. Do the benefits outweigh the risks, or should women stick to traditional hormone therapy?
I was having severe migraines, sleep disturbances, horrible PMS, I just felt horrible.
Now Tina Lowe says she's never felt better.
Like I did in my late 20s.
Linda Conley also had troublesome symptoms.
I can't sleep well. My hair is falling out.
She didn't like the help she was offered.
Here's antidepressant. Take this. Here's some medicine for anxiety. Take this.
I am almost ashamed to be a physician, the way medicine moves so slow. How you doing?
Dr. Ken Holtorf has built a booming practice made up of patients who say they were let down by conventional doctors.
Their patients come in depressed, can't lose weight, fatigued.
Dr. Holtorf claims he can relieve most of these symptoms by manipulating hormone levels. Patients pay cash here, about $400 for an hour consultation, plus several hundred more for lab work to analyze their hormones. Tina says her testing confirmed
My estrogen was low, my progesterone was low, and even my testosterone was low.
Linda was also diagnosed here with hormone imbalances. She started hormone replacement in March.
And it's the best thing I've ever done for myself.
Tina and Linda aren't taking prepackaged pharmaceutical hormones. They're taking bioidentical hormones. The same stuff Suzanne Summers wrote about in her book Ageless. These so-called natural hormones are often derived from plants, custom blended by a pharmacist. Holtorf tells patients the stuff is safer.
And they prevent breast cancer, prevent heart disease, while synthetic hormones cause breast cancer.
The evidence this treatment works, Dr. Holtorf says, just ask his patients.
I went from feeling like an old lady to feeling like a vibrant, healthy individual looking forward to the rest of my life.
I've lost 53 pounds since, I think, March 11th, and I'm feeling better and better.
Well, it's interesting. Everyone wants healthcare reform for different reasons, but we find a lot of patients are so frustrated with the insurance model. Their premiums are going up, but the care is going down. And what you find, even like a doctor's visit 5 years ago, averaged 16 minutes. Now it's less than 6 minutes.
God, I wish I could do the model that Dr. Holtorf has with the cash only.
I'm shocked when I heard this topic. It exists. What is male menopause?
It does exist, and it doesn't get a lot of publicity or play because women know what menopause is. They get their symptoms pretty quickly after the estrogen drops. Mm-hmm. But for men, it's different. It's a slow progression decline. Mm-hmm. So they won't associate the symptoms. They'll think it's just aging, and they won't know it's from low testosterone because it's not an immediate decline. It's progressive over 10, 20, 30 years.
Wow. So at what age might it start then?
It usually starts about 35, but we're finding younger and younger people are coming in. And again, some men will drop faster, and other men will be okay in a slower decline. So symptoms depend on what level that you get to on testosterone.
So what are some of the symptoms you might expect?
Typical symptoms are fatigue, depression, low libido, erectile dysfunction, kind of lost passion for life. They kind of don't want to do anything. Also, they don't get as much out of their workouts. Kind of lose that edge.
Maybe a little depression too?
Yeah, just kind of a blah.
Yeah. So at your medical group, you say you notice that more and more men are coming in for this, right?
They
their
really
wives
are.
Making them?
They really are. Well, we'll get a reason for coming in. My wife made me. It says you can't stand living with me anymore. And we find that they're often low testosterone. And again, because it's slow decline, they don't associate it with that, a month or two. It's a progression. They think it's just aging.
So how do you treat it?
And basically, the first thing is a diagnosis, because the problem is they go to their doctor and they'll say, well, the blood test is normal. It's not from low testosterone. They'll give them an antidepressant or something else. But the problem is they were high normal before, now they're low normal. So they may be in that normal range because normal is 95% of the people. Only the lowest 2.5% will be considered abnormal.
Right.
Let's see the lowest 5%. They'll say, well, you're normal. But if you bring them from low normal to high normal back to what they were before, all their symptoms go away. Passion's back, their energy, their libido, and all that.
So how would you know if it's lower testosterone or just maybe depression or something? Wouldn't you have to get tested now and then maybe like 2 years from now, 3 years from now, 5 years from now?
That's a very good point, and that's what the people are saying, but most people never tested to begin with.
Right.
So, and we're finding especially people with higher levels of testosterone, executives and people that have athletes, actually now they may be fine, they look fine when they're older, but they actually had much higher levels. Right. So they suffer more than others.
So should men who are in their mid-30s, as a part of their routine physical examination, get tested for low testosterone or male menopausal symptoms?
I mean, that's a great idea, but most people don't. So what it is, we know the syndrome of low testosterone, and really you want to treat the underlying cause. If someone comes in with depression and fatigue, they're low testosterone, give them a trial of testosterone. Mm-hmm. Much better to treat the underlying condition rather than give them some antidepressant or something else.
Are there side effects to be concerned about with the treatment?
Well, the nice thing is we were taught in medical school that you don't want to you have to worry about testosterone because men get heart disease, women don't. So testosterone can increase the risk for heart disease. It's finding that's the opposite. Low testosterone increases the risk for heart disease.
Right.
Going from low normal to high normal, you lower your risk for heart disease. Also, we were taught that it increases prostate cancer.
Right.
And that was found to be inaccurate. And low testosterone increased the risk for prostate cancer, not high. So all those risks that we're worried about are non-existent.
Now, I know this is probably a total myth. We've heard this, that if you give a man testosterone, it won't make him have, like, roid rage or go crazy, right? Like,
No, you hear that, and because, testosterone gets somewhat of a bad name because it's abused by these bodybuilders and athletes,
Right.
and they are taking massive doses,
Okay.
50, 100 times the dose that a normal person would take. I mean, you try that with Tylenol, you're dead. And you can get side effects, certainly, when you're doing that, but at normal physiologic doses, you don't see that. People just, they're calmer,
Right, that's what I hear.
that cranky old man syndrome goes away.
So,
is it for everyone, though? Like hormone replacement therapy?
that's my question, yeah.
Well, yeah, I mean, nothing's for everyone, and some men will be okay. They won't drop so much, but a lot of men now we're finding more and more they're dropping much quicker, and a lot of probably from environmental factors, toxins, pesticides, plastics. Drinking out of plastic water bottles lowers your testosterone level.
Wow.
Yeah, stress, weight gain also lowers testosterone, but also low testosterone causes weight gain, so it's a vicious cycle. So men come in, they can't lose weight, you fix their testosterone, they can now lose weight.
So
Wow, that's
other
amazing.
adjustments might be helpful too, right? Like eating properly, exercising, doing all those things to stay physically fit.
It does help.
Along with
it does help, but if you're declining, it makes it much harder to actually get out there and exercise and get the motivation to do it.
Gotcha.
So it's a vicious cycle.
Okay, well, if you want more information about Holtorf Medical Group, you have one place here in Foster City.
Yeah,
and
we're in
one
Foster City now.
And one down in Southern California.
Yes.
Okay, more information about
Fascinating.
Dr. Kent Holtorf on our website, and of course about
Interesting.
male
Thank you so
menopause.
much.
Very
Thank you.
interesting.
Yeah.
Thank you so much for the info.
all right.
Dr. Kent Holtorf joining us here with the 5 questions every woman should ask about hormone replacement therapy. And thank you so much for driving all the way from Los Angeles
No
for us
problem.
today.
Thanks for having me.
You got it. Okay, so those 5 questions, lay them on the line for us.
Well, really, I think the number one question is terms of bioidentical hormones. That is the big controversy currently. It was on Oprah. Everyone's talking about bioidentical hormones, which are hormones that are exact copies of what's in a woman's body, as compared to the synthetic versions that are commonly prescribed. So the question is, you hear people saying, well, I feel better on those. Are they really safer? So what I did, I reviewed all the data, all the literature on bioidentical hormones compared to synthetic hormones, was just published in a major medical journal, postgraduate medicine, peer-reviewed. And what the analysis showed is that bioidentical hormones are truly significantly safer. They reduce the risk of breast cancer compared to synthetic hormones that increase the risk of breast cancer. They have superior cardiovascular protection, so they lower your risk for heart disease, where you hear all the studies on synthetic hormones causing the strokes, heart attacks. The Women's Health Initiative study, the big study that came out.
So from a real basic perspective, putting it in plain English, why is it better?
It basically because the synthetic hormones will actually increase inflammation. They will basically cause the breast tissue to divide and increase the risk for breast cancer. For instance, the difference between progesterone and progestin, and doctors will lump these together. They sound the same. Mm-hmm. So you can either use a hormone replacement preparation with progesterone, with progestational hormone, which is required for the baby to grow. That's what is normally in a woman's body. Mm-hmm. What normal doctors will do is give a progestin. It's altered, so it's synthetic. The best way, again, to prevent breast cancer is take progesterone. The best way to cause cancer, if you would want to do that, is take a progestin.
Which none of us do.
They're the exact opposite.
Okay, so we're getting back to the 5 questions. So you're saying from your study and from your paper that was published and peer-reviewed that it is completely safe, it's better to do it than synthetics, but of course, we want to ask all the right questions.
Correct.
What are those questions that we need to be asking?
I would say the number one question, women, when they go to their doctor, they want to know, why are you taking these hormones? What is the purpose? Are you taking it for symptomatic relief, which is the most common? Are you taking it to prevent disease, prevent aging, to look better? Or is it because you're friends doing it? So you need to find a doctor who is knowledgeable about that. And let's say it's for symptomatic relief. Now you need to find a doctor that can customize these preparations for the different symptoms. For instance, let's say a woman has a lot of menopause symptoms but very anxious. Mm-hmm. Then you would use more progesterone. If you have a person who has more menopausal symptoms, hot flashes, insomnia, depression, you want to use more of an estrogen base. Now always combine, but different ratios. If it's a libido problem, very common, you want to use testosterone with it. Now the problem problem is you go to your gynecologist and you go, okay, I need hormone replacement. They go, well, here it is, off the shelf, one size fits all. And it usually has progestin in it and increase the risk for stroke, heart attack, breast cancer. So why not use what is going to be safest and prevent disease as well as alleviating the symptoms? And the studies also show that women do feel better on these hormones. They don't have the side effects. They don't get the weight gain, the bloating, the anxiety that are associated with the synthetic hormones.
Okay, well, sometimes when we hear about the warning signs like could cause, leakage, all those scary things.
Right.
With the non-synthetic, what are some of the side effects or possible risks?
Well, when you look at, everything has risk and benefits, and the problem is when you look at the risk and benefits of hormones, they lump them all together, and you can't do that. They're very different molecules. They have very different effects. So when you look at bioidentical hormones, studies have shown no increased risk of breast cancer. Now, especially if you want to give a lot of progesterone, and again, that's very preventative. So also, you get the benefits without the risk of, say, well, I want to feel better, but I'm going to increase my risk for stroke or heart attack or breast cancer. Okay, so you're getting the benefits.
Dr. Kent, what about an age limit or age factor? When should women start looking into this, and what's a general age rule?
That's a very good question. And what we find, too, and as women age, basically their estrogen will drop, but the progesterone drops faster. So about 10 years before their estrogen drops and they get symptoms, they'll typically get symptoms of PMS, irritable, very crabby. And
we do that?
That's it.
Oh, I beg to differ.
And so if you can find a doctor that can treat those perimenopausal times with progesterone before the estrogen drops, women are going to feel much better.
And maybe we'll need less chocolate.
That's it. And actually a nice study came out showing that actually women who are PMS, the 90+% are low thyroid. But the standard blood tests don't pick it up. And so they need to look at that and some progesterone, and women just go, oh my gosh, I'm a new person.
Right. Oh, and that's really what matters, is our quality of life.
And you're also preventing cancer.
Right. Oh, my gosh.
Which is the opposite of what you basically hear. Then as they go into menopause, then you start replacing the estrogen with bioidentical hormones. So there's two different typically bioidentical hormones that are used. One is estriol, one is estradiol. The estriol prevents cancer. Why not use it?
Thank you so much for joining us. We are out of time, but we will link our viewers to your website, can get more information, and direct us to folks in town that have all the knowledge and research that you do.
Thank you so much.
Great to have you on today.
For today's Healthy Horizons report, I'm Rebecca Jarvis.
How you doing, Dr. Holtorf?
Good to see you.
Christopher Smith is your typical executive, high-functioning and driven.
No more fatigue?
Not the case 3 years ago. Suffering from exhaustion, he got his wake-up call.
I was very depressed. I lost my edge in running my company, so that led right to Dr. Holtorf.
A lot of people come in and say that they've lost their edge due to age-related decline in hormones, including thyroid, testosterone, growth hormone. And we'll replace those hormones back to more youthful, optimal levels. B12 level looks great.
Dr. Kent Holtorf specializes in endocrinology and age management. He says executives tend to start with higher hormone levels, so when they drop, symptoms are even more dramatic.
I like the look.
For 52-year-old Smith, who runs an apparel company in California, that meant getting sick frequently, losing his patients constantly, his focus gone.
Within 90 days, I was back to being Christopher again.
He still sees Dr. Holtorf, takes multiple hormones. He also eats right and exercises regularly.
It was a beautiful thing.